You are listening to the global network of podcasters dedicated to the pharmacy profession. Welcome to the Pharmacy Podcast Network.
It is a cold this week in pharmacy. Welcome back to TWIRx. I got my Burry guy here on the desk that just says exactly the way it is at a -2 here in Pittsburgh this week. And then I think it was -9 on Thursday morning, or it might have been Wednesday morning. I'm losing track. But what a fast week it's been. This is a wonderful time of year. We have some key conferences taking place. I want to bring your attention, the listeners out there. If you're watching on YouTube, you'll see our intensity here in the blue background on purpose with the chilliness of the north up here and how cold it is. But let's talk about this new conference that's coming out from someone who understands first-time conferences for pharmacy owners, for pharmacists, for people changing the game. Way back in the day, 15, 20 years ago, PDS, Pharmacy Development Services, came out, and it was a conference like no other. PDS was a rock star conference. It was new to pharmacy. It was new to marketing. It was the fusion of both of those concepts, and then taught how to move forward along with the networking. So the conference keeps evolving. And I want to introduce Dr. Nicolette Mathey. Welcome her back to TWIRx this week in pharmacy. Nicolette, welcome back. I hope you're out there and hope you're. Oh yeah.
Thank you, Todd. My gosh, it's cold.
Chilly in Orlando, Florida. What part of Florida exactly are you in right now?
I'm in the Tampa area, Clearwater Beach.
A little bit warmer than Orlando.
A little bit, but it's still cold.
I bet. Yeah. All right. So something special's happening. You heard the intro. You were part of the evolution of what happened in the pharmacy conferences and how it really became a lot more dynamic and a lot more interactive and a lot more actionable through really understanding how Dan set the world on fire in the realm of marketing and about really like nullifying it and making it real and making it palatable and changeable and what that meant to pharmacies. But tell us about this next evolution in ATRIUMX and what we're going to be doing in this. It'll be chilly February here in Pennsylvania.
Yeah, that's for sure. Definitely up north. Come down and spend some time with us in Orlando in February. The ATRIUMX conference. I'm excited about it because I've been on the trade show circuit for over a decade now, seeing, every conference has its own kind of personality, and they're valuable. And there's been a gap. If some of you remember kind of the older PDS conferences, and they were just so electric, and they were so just a mind space for everyone to gather and share and be inspired. And that specific format has been missing for some time. I've always known that I wanted to bring it back once it left, because there's a gap. And a lot of key vendors have been approaching me and saying the same thing, like there's a gap. Let's bring this back, and let's bring this kind of brain trust back to the conference track.
I like that, and I like the fact that I got to experience it in its what we know as its heyday, where the passion was flowing. And every year, Kelly Babcock and Dan and you and Lisa Fast and all of these disciples of this Knights of the Round Table changed the game, and now we're giving the next evolution to the pharmacy market. But what's kind of special about it is how the people that invest in this conference get to actually be part of the formation of the conference itself and the event itself and the themes itself. That's crazy and that's amazing. So talk to us about that whole concept and how that came up.
Yeah, and it's going to be very different So you definitely want to be there to witness it and experience it. Don't have FOMO. It's never been done before in our independent pharmacy industry, but essentially we're crowdsourcing content. So this is challenging, especially for a very detailed pharmacist like me, but we don't have all the sessions planned out. We don't have all the PowerPoints planned and peer reviewed and CE and all that stuff. We have some of those traditional content blocks for some really important metrics. We're going to talk about, telemedicine. We're going to talk about tirzepatide. We have legal representation there to tell us what's going on with 503B. We have long-term care innovations. And to your point, we have these breakout sessions that are scheduled, and we're going to physically poll the crowd. So Scotty B is our MC, and he's physically polling. So if you are a compounder, go over there. If you're a long-term care pharmacy, go over there. Do we have any sterile compounders in the house? Do we, so that we can all visually understand who is there in the crowd. And then we're all going to vote on, what do you want to talk about? There's been a lot of concepts coming up, such as even things like, we have expert facilitators. Kelly Babcock is going to be facilitating at ATRIUMX, Terry Norvell, Jen Deal. So you could talk about performance improvement plans. You could talk about incentive plans for your team. You can talk about culture and leadership. We can talk about sales and marketing. We have a lot of expertise with the vendors who are there, with the attendees who are there. So everybody's going to get to vote. And then these breakout sessions will be on what the folks in the room voted on, and then what they want to share with each other. So we're essentially taking my favorite part of conferences, which is what happens in the hallways, the lunch tables, the lobby bars, and we are curating it and putting all those like-minded people with some forethought into the same room with expert facilitators who have been trained on questions to draw out exactly what's going on in everybody's business.
I also want to say, you and I, we run these same circles. Pharmacy is a very, very small place. Even the fact that of it being multi-sectors, health system and specialty, and the whole component of becoming practice in collaborators with physicians in the same office. And I mean, everything's evolving. The at-home, sector of it, it's exciting. But the vendors that are the strategic partners who actually get it, they remember the secret sauce of what we were just talking about PDS. They remember the feeling. They remember the electric. And one of those people that's a dear friend of both of us, it's been around the block a couple times at least, is Bill Holmes, the founder, the developer, the launcher of RxSafe, and how big that has impacted in the whole multi-doses, how that's impacted the entire industry, especially long-term care and long-term care at home before it was called long-term care at home. But Bill's special. He's bringing us all together with his investment in this. He believes in this. What other partners and people out there do you want to kind of shout out to that and I know are the reason that this is even happening, because they're helping to support, make it happen?
Yeah, absolutely. Because I've learned that these conferences are not cheap to put on. Oh. So not only are they a lot of work, and there's a ton that goes on behind the scenes, which I was privy to some of it when I worked as the clinical director of PDS, but not all of it, as I'm learning now. And luckily, we have a great production team that does a lot of the details. But Bill has been instrumental. It's been so fascinating to spend time with him and learn how he started with the Pyxis machines that would just count even pieces and screws and things, and how he evolved into pharmacy automation technology. And he really is a visionary. And he sees how much work goes into curating these conferences and putting them to get together. So he knew that there was a gap in the marketplace. And he was kind of the first one to put up a check and say, this conference needs to happen. The industry is struggling, and we need to come together and figure this stuff out. So big thanks to Bill and RxSafe, Icon, and also he brought in Liberty, and then also GeriMed. And so they've been with that core group, I felt comfortable enough to say, okay, it's not just Nicolette on the hook here in Atrium24. Now we can actually go sign these contracts with the hotel and just really put it out there and put the flag in the ground and say, we're having a conference. So couldn't have done it without them.
So Nicolette, before my world in podcasting and networking and public relations, my entry into pharmacy was the pharmacy technology systems that ran institutional pharmacy and long-term care, Framework LTC, run by SoftWriters.
Yeah.
The Liberty software systems that integrate our community pharmacies, our long-term care pharmacies, and the evolution of home care being treated as almost like a long-term care extension from the community pharmacy. It's all an evolution. Being able to be at one of these conferences, that means that they're able to listen and learn and interconnect and stay ahead of what next evolution of the pharmacy management system is going to really help us execute the next phase of what pharmacy care is bringing us. And it's key to have those kinds of real technical people, operational software people there, so the gears are turning in their heads, so they're staying ahead of the game. We're helping our key partners continuously evolve with us. And I have to do that. I have to do that as a public relations, as a marketer, as a messenger, as a communicator. I have to listen into the grassroots, the people in the trenches, the pharmacists doing the work, the technicians doing the work. So, by the way, we want technicians there. I want Mike Johnston and MPTA to announce that this conference is happening, because you know as well as I do, Nicolette, how many pharmacy technicians are now leading operations and are leading the evolution of what's happening in pharmacy.
Absolutely. So it's exciting to see the registrants that we got so far. Every time a registration comes in, I'm like, oh yes, they're going to be there. I think they can talk about this, and this, and I can't wait to pick their brain about this. So it is going to be so much fun having all these bright lights in the same room.
All right. So quickly, let's review for the listeners. If you're not watching on YouTube or LinkedIn or Twitter, don't worry about it. If you're listening, we're going to have it in the show notes. We're going to take you right to the registration page. Join us in warmer Orlando, Florida on February 27th. And we're all pulling for a heat wave that week, by the way, Nicolette. So it's not 40 degrees in Orlando.
Possible. You never know with Florida in February, but it'll be nicer than up north.
That's true. Margaritaville Resort, Orlando. What a beautiful place. It's going to be a great venue, a great get together. This is also going to be a lot of fun. And once again, if you think you have something, if you have a secret sauce that you think could really impact the pharmacy market, if you think you're an innovator, if you think you have great ideas that could impact other pharmacy owners or connections to hospital systems, back to ambulatory care, back to home care, back to skilled nursing in the home, remote patient monitoring. Goodness gracious, I could shout out probably 36 people just sitting here thinking of who needs to be at this conference. But we're excited to be a part of it. Pharmacy Podcast Network and RXPR is leading the promotion of this through online engagement. If you are an organization that wants to support this conference, ATRIUMX, reach out to Nicolette, reach out to me. We'll get you in touch and get you ready to go. So I'll see you in Margaritaville, Nicolette. It's going to be great.
Yeah, I can't wait.
All right. Talk to you guys soon. See you in Orlando.